Identify the probable cause of acute shortness of breath in a 63-year-old man who has returned to the emergency department 2.5 weeks after coronary artery bypass surgery. The patient reports experiencing chest pain and shortness of breath an hour ago, has a history of hypertension, diabetes, and 2 myocardial infarctions. The patient is hypoxic, with an oxygen saturation of 86% on room air, and an ECG shows no change in the interval from his most recent ECG. CT of the chest is shown in the image. Choose the most likely etiology of this patient's shortness of breath from the following options. A. Aortic dissection. B. Exacerbation of chronic obstructive pulmonary disease. C. Myocardial infarction. D. Pleural effusion. E. Pulmonary embolus. Pause and think about the diagnosis. The most appropriate response is option E. The patient is at a higher risk of developing pulmonary embolus due to recent surgery, which may have limited his mobility in the postoperative period. The enhanced CT scan of the chest reveals a filling defect in the right pulmonary artery, which is consistent with pulmonary embolus. Anticoagulation therapy should be initiated for the patient's treatment. Malignancy, pregnancy, and hypercoagulable states are among the other common risk factors for deep venous thrombosis and pulmonary embolus. Option A is incorrect since there is no evidence of aortic dissection on the image. Option B is incorrect since the patient doesn't have chronic obstructive pulmonary disease, COPD, and a COPD exacerbation would cause wheezing during the physical examination. Thus, this diagnosis is less likely. Option C is incorrect because although the patient's history of diabetes and 2 previous MEs increases the risk of an ME, this is not the most likely diagnosis as there is no change in his ECG, and a pulmonary embolus is present in the CT scan. Option D is incorrect since the pleural effusion, although present on the CT scan, is not large enough to cause the patient's acute chest pain, shortness of breath, and hypoxemia. The effusion may have occurred due to the patient's recent thoracic surgery.